Abdominal trauma is a very debilitating form of trauma which has its own complications. There are a lot of important visceral structures that are present in the abdomen and in the pelvic region. So it's basically, it has got its own first aid, and the management criteria are also very different in these abdominal and the pelvic regions. So we'll be dealing with that in this section, the abdominal injuries and what are the complications of these abdominal perforations or the penetrating injuries that can occur to the abdomen. What are the structures? What are the anatomical, basically, structures that are lying over there, and that can be damaged in such cases of the abdominal complications. Foreign bodies in gut is another phenomena that is encountered by a lot of doctors, and it's basically very common practice that we find foreign bodies in the gut. It has its own background. It can be psychological states, it can be some perforations or penetrations, and we have to deal with them accordingly. Then we have the injuries to the pelvis and the pelvic organs. So pelvis is another region which has a lot of important organs. Genitourinary tracts are present over there, and that can be damaged through any perforating or penetrating injury that occurs to this part of the body. So the abdominal injuries, if we talk about, it can damage by the basically the blunt trauma can be the cause to these abdominal injuries. Blunt weapons are, again, depending upon the location of the injury, what structures are lying over there. So we will be basically focusing on the surface landmarks for these structures. The surface landmarks will help us locate what kind of structures are lying under that area, and that can be damaged in such traumas. Again, the intestines are target for perforation. Intestines are very delicate, and they are a target for perforation in any perforating or penetrating injuries that can be encountered by a person in any road traffic accident, stampedes, or whatever kind of trauma that he had. Then we have the open or penetrating wounds. Open or penetrating wounds can again be ensued as they can be the firearm injuries, they can be the sharp weapon injuries. All of these can basically cause the penetrating or the open wounds, again damaging the visceral structures or the visceral contents that are present in the abdominal or the pelvic area. Now, whenever we are referring towards this diagram is very important in a sense that it is basically telling us this is basically the posterior axillary line, and this is the anterior axillary line, and this is the flank that we usually refer to. Whenever there is a flank injury, it's basically lying between the anterior and the posterior axillary line. So you have to know basically the exact anatomical position, whatever we are referring to. And then we have, this is the anterior abdomen, this is the anterior thoraco-abdominal area. So some portion is basically, there is not a clear-cut demarcation, and some portion is basically thoraco-abdominal. It is half thorax and half abdomen. And then we have this back area that we usually refer to as the back injuries, and the posterior thoraco-abdominal area is lying over basically this abdominal spine area, correlating to the abdominal spine. So this is very important because these are the terminologies that whenever we are dealing with any case of trauma, these are the terminologies that we are using right over there. So basically the open or penetrating wounds need little description, because we cannot really comment on the type of damage that it has taken place inside. So it's only the physical or the outer look that we can comment upon, the size, the anatomical position that the trauma is present on. Only these things can be commented upon. The liver and the spleen bleed extensively, causing the hemoperitoneum. Hemoperitoneum is again the collection of blood in the peritoneal cavity. So liver and spleen are a part of these abdominal structures, and that can be damaged through this presence of this blood in the peritoneal cavity. Overlapping nature of the coils and their mesentery, it occurs only in the presence of the multiple wounds. If there are multiple stab wounds in the abdomen or the multiple firearm wounds, it can result in the damage to the mesentery and its coils. Again, the kidneys rarely are stabbed except from a thrust in the back. So the back or the flank is the portion that is basically going to damage the kidney. So these points we have to keep in our mind. Now the closed and the blunt injury are again the accidents and assaults. They are basically dealing with these closed or the blunt injuries. The liver, intestine, spleen, mesentery, these are the most vulnerable viscera that are present in the abdomen that can be encountered whenever there is a closed or a blunt injury. Now the autopsy features. What we will be looking at whenever we have a patient, whenever we have a body who had a abdominal trauma. We'll be looking for the bruising of the abdominal wall, of course. The blood may track down down the inguinal canal, and it may appear in the scrotum or the labia. So, extensive bleeding into the peritoneal cavity is another feature that can be present. And bruising or rupture of the stomach and the diaphragm. It is something that we can encounter in the post-mortem. And the intestine and mesentery are frequently damaged in the abdominal trauma. So again, so all the structures basically lying in the abdomen have to be sent to the chemical pathologist for detailed examination. The rupture of the spleen is another phenomena which can be seen either from the impact on its surface or from traction on its pedicle. Rupture of the liver is another phenomena. Spleen, liver, stomach, intestine, mesentery, all of these structures are at stake right over here. Injuries to the kidney and the perirenal hemorrhage. Perirenal is basically the outer portions for the kidney. The kidney capsule is basically the perirenal area that we are referring to right now. Now, the foreign bodies in the gut. This is another phenomena that is very commonly encountered in the OPDs. What are the causes to it? It's not a usual autopsy or the clinical feature. Disorders of the mental state. There are a lot of disorders in which the person has basically even hair in the gut, and that is basically the psychological conditions that he's suffering from. So the aberrations are basically, maybe it's not a foreign body, it's a normal alimentary tract structure, and the person has referred to as a foreign body. It can be basically aberration. And sexual perversions, for example, necrophagia. All of these are a part of the these findings of the foreign bodies in the gut. This is basically all the states in which we can find the foreign bodies in the gut. Now, the smuggling of the narcotics, again, they are basically known as the body packers. This is the specific terminology which is used for people who basically carry drugs in their intestinal tract. So, the smuggling of the narcotics can again be another part for this. Complications of the abdominal injuries can be again hemorrhage can occur, perforation of the gastrointestinal canal can occur, and the injuries to the pelvis and the pelvic organs is another complication whenever there is an abdominal or a pelvico-abdominal trauma. Severe trauma is basically great pressure applied in front of the abdomen or the pubic area. It can be any blunt force trauma, sharp force trauma, firearm injuries, whatever the case may be. Now, the pelvis is splayed open in this great pressure cases, and the symphysis pubis is parting. One or both the sacroiliac joints are dislocated, and impact from the side. So the front pressure is basically going to put pressure on the pelvis and the pubic symphysis. Now, the impact from the side is basically going to shatter the superior and the inferior pubic rami and dislocate the sacroiliac joints. So this is basically an impact from the side. Now, a fall from the height onto feet, it is again going to put pressure on the pelvis, and it is going to dislocate the hips, pelvic girdle may crack, and the sacroiliac joints are sheared apart in such cases. Now, the kick or heavy falls into the base of the spine is again going to dislocate the spine, and the fractures of the coccyx and sacrum can occur in such cases. So basically, the external genitals are again they're also a part of the pelvis, and they can be damaged in sexual assaults, in kicking phenomena. Scrotum is vulnerable to severe bruising, and large hematocele may develop in such cases. Scrotal and vulval injuries from the following astrotide and object, for example, in the road traffic accidents, are a part and parcel for these pelvic or injuries, and the external genitalia can be damaged in such cases. So in this section, basically, we dealt with the abdominal and the pelvic injuries in general, and how can we basically manage such cases, what are the types of injuries, and how can these traumas occur to the pelvic and the abdominal organs. So that is the end for this section. Thank you for watching sqadia.com.